Hey everybody, it's Mordecai from Queer Universe, and today's video I wanted to share some more news with y'all. And frankly, this is the best news I've gotten thus far in my transition. So yeah, I'm just gonna get right into it. So with insurance hopefully approving my my appointment, won't know until August because it has to be like 30 days before the appointment. I'm getting top surgery in September, specifically September 24th. So, I am over the moon. The day that I went for my consult, and when we got the date scheduled, I'll go into it in more detail after this, but when I got the date scheduled, it just didn't seem real to me. And she asked me, how does that sound? I'm like, perfect, cool. Because, I didn't expect it to be overnight or anything. I just wanted it to be this year, which it is. And, yeah. The next day, on Saturday, I was just like, holy crap, this is actually gonna happen. I am actually getting top surgery. So yeah, so on Friday, the 31st of May, I don't remember my months, yes, the 31st of May, I went up to UAMS where I go to get my tea. My HRT doctor, she referred me over to a doctor that she knew in the same hospital. It's a different area, in the plastic surgery department, because we don't have a top surgery doctor here in Arkansas, which sucks. But yeah, he's the next best thing, and he was really cool when I met him. And he's been doing this for years now, so yeah. Anyway, I checked in, and I was really afraid, because I was sitting in the waiting room, and they would call people back, and they would say Miss last name or Mr. last name, and I was just like, oh no, not wanting to do this. So it came to me, and they just said my last name, Russell, and I was just like, oh yeah, it's me. So I went in there with my service dog, and did the weight and temperature and all of that good stuff before you go and wait for your doctor. So I lost 10 pounds. That's an awesome note to bring up. I haven't even really been doing anything, but yeah. So he was really nice, and then he was like, I have to take it, or this woman doctor that we have, or I guess technician, not the actual doctor, we'll have to take pictures of your chest, because Dr. Wolter wants to have those for, the surgery purposes. And the dude was like, you won't offend me if you want the female one. I'm just like, we're both dudes, it won't be that awkward, so yeah, sure. And that went well. And yeah. So I had this red gown. It was like a cape over my breasts, and just waiting for Dr. Wolter to come in, and the technician, he was like, it's nice to meet you, sir. And I was like, oh yeah, nice to meet you too. And then Dr. Wolter came in with, I think, an apprentice, I guess, or just someone that worked with him, I'm not sure, but she was in the room too, which is cool. And he, introduced himself, and he was like, good to meet you, sir. And I was like, oh, good to meet you too. And with that out of the way, he, started off with not in top surgery. I mostly do stuff for breast cancer patients, but what he did was that when he was training up in Michigan, that's where he came from, in medical school, they had a program where they introduced people to treating different gendered people, trans and non-binary people who need top surgery, of that nature. So he's familiar with it, and he's been doing it for years, like I said. In the beginning, he was more conservative with how much tissue he'd take off the chest, but that would lead to more revision, and now he takes more off, and he's better at doing it. you know, that's what comes with all the practice. And so we were talking, and it was funny because he listed off how, like, you know, people have all sorts of different problems with, like, having a large chest, and listed off stuff such as, like, social embarrassment, back pain, and stuff like that. And I'm just like, everything you said matches with me perfectly, because I have dealt with this since I was 8. That's when I started developing boobs because of a nice little genetic disorder I got. But yeah, talked about that, and then he was like, you know, if you ever want a bra, and I'm like, no, but like, estimated, like, my breast size is like an F, and he was like, oh shit. And I was like, oh, yeah, I know. I've had to deal with this for a while, I know. So then he examined them, measured them, and all that stuff. Which, like, it didn't, like, bother me or set off my dysphoria. I was fine with it. And I was like, you know, he has to do this. He's a doctor. And, yeah. I found out my right breast is significantly bigger than my left one. Which, yeah, I kind of knew, but not really. So that was cool, I guess. But what he's going to do is he's going to, since, like, my breast, they dip pretty, like, sag to about my mid-stomach. That's where, like, my nipples are. And so he was like, we're gonna amputate the breasts and then, like, take a skin graft of your nipples and, like, make them more masculine looking. So that's what they're planning to do when I go in for top surgery. And yeah, I have my pre-op date for the 13th of September, because they want me in 2 weeks before that. And then yeah, it was also funny because he's like, he mentioned drains, and this is like, oh no, because I've read about that in several trans groups I'm in. Because, you know, I want to be prepared, and I want to know what's coming up. And so he's like, oh yeah, you've heard of them. I'm like, yeah. So I talked about them. They'll be in for 2 weeks, and he asked me if I had any questions, which, like, at first I didn't, or I did have one. I didn't really, like, phrase it as I wanted to, but the one that I asked, I was like, you know, do I need to, like, not shower for a week? Because I've heard that other trans people had to do that after their surgery. And it's about to rain. That's why I keep looking that way, because my dog's outside. So sorry. But he said that I can take a shower 48 hours after I've had my surgery. So a 48-hour wait, which is not that big a deal for me. I take showers every 2 days anyway. So, yeah. And, I guess, like, pre-op, I guess I'll have, like, more questions, but I may just ask them in groups and stuff, and then, like, ask his, like, actual opinion, I guess, and, like, what he does in his practice. Because I'm an awkward potato, we all know this. And I was just like, yeah, that. And I think that's all I asked him about. Yeah. But, my dysphoria did go off, not because of any of the staff. The staff were lovely. Oh my goodness. I didn't expect to be called Sir, Mr., anything of that nature. It's awesome. So, I came out of, the physician area after my appointment to check out, came back into the waiting room, and I came out the double doors, and there was this guy. He was pretty old. I say pretty old, probably like around the late 40s, early 50s. I thought he was older just because, like, he had gray hair and stuff. But, he was standing really close to the double doors that I was coming out of. I'm like, what the hell? But, you know, say sorry, because I try to be polite. And he's talking to me about Haley, my service dog. I'm like, yeah, cool. Just talking about how, like, labs are good dogs. She's a lab, and stuff like that. Like, okay, cool. I'm trying to check out. I want to go home, because I'm tired. So, checking out, trying to get a pre-update, and trying to talk to the receptionist, and he starts saying, ma'am, 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 over and over again. I'm like, no, I'm not responding to that. And then, like, after that, he kept saying, miss, miss, and I'm like, I'm not that either. I'm not any of those things. I am a sir. I am a man. I have facial hair, which, feel like this side is more prominent than this side of my mustache. And then I have sideburns, like they're curly AF, but you know. I got that Jew curl, as one of my other Jewish friends have told me. If this is your first video watching me, I'm Jewish too. So, yeah. Anyway, he kept calling me ma'am and miss, and I'm like, you know, not gonna respond. So I turned to leave with my service dog, and she's guiding me, and he steps in front of us, and he's like, she has goop in her tear ducts. I'm like, yeah, she sleeps a lot, like I do. She gets eye boogers. I'll deal with that when I get down to the car that took me up here. It's not that big a deal. It probably happened while she was like sleeping in the waiting room, and I just didn't notice. Well, anyway, you know, I thank him, and I'm about to leave, and he's like, you have a good day, ma'am. And I just don't answer him. I'm like, not a ma'am. Not a ma'am. Why do you fucking think that? Like, yeah, my boobs are significantly larger than most people's, but, like, that doesn't automatically make me a woman, because I'm not. So, yeah. Dr. Wolter knows that, like, that dysphoria goes into the chest thing, but, like, telling that to insurance, they're not gonna really listen to it, because it might not be as trans-friendly, and so, like, yeah, the other things, like back pain, neck pain, and, social embarrassment, and unable to really exercise and stuff, like daily life, gets in the way of that too, using that as well. So, got it all covered, that way, make sure that, like, insurance has the least chance of denying it as possible. So, yeah. I'm trying, not to let my hopes get squashed, because, like, I've waited so long for this, and it's only, let's see, it's June. It's only in 3 months, and I can wait that long. It won't actually be that long. Like, it'll feel longer than it is. And, yeah, I just have 2 months to wait until they say something. And there's a higher chance that they'll approve me if, I'm legally identified as a male, which is still needing to be approved by a judge, which should happen this month, I hope, if not July. But, yeah, they're more likely to do that because, like, they'll consider gynecomastia and treat that with removal. But if that doesn't work, and, like, my name change and gender marker change doesn't come in time, which it should, but on the chance that it doesn't, they might just, like, go for a reduction, and, like, he made sure to tell me, you know, reduction, and we'll just go all the way, you know, just take off all that stuff. So, yeah, I'm really excited. I really am, and I'm actually allowing myself to get my hopes up this time, which is really hard for me, because, like, I try not to, because anything can happen, you know, but it's happening, and it's really happening, it's really coming, and I need to talk to my advisor / professor about this semester of college, but, like, if I have to wait a semester until I go back, I don't know. I don't care, because I'm getting this. And, oh boy, I'm excited. So yeah, I just wanted to share that with y'all, and yeah. So, I'll update when I know more, like, when insurance approves it and stuff. So, of course, I will be posting about that quite frequently on the channel, and yeah. I'll see y'all in the next video. Love you all. Stay safe. Hope you're having a good day, evening, night, wherever you are. And I'll see ya.